How far would you go for beauty? Would you go to the extreme of having your makeup permanently applied? With us today is Debbie Miller, a permanent makeup specialist, and she just completed the final touches on Trish in our procedure room. We'll see her results in just 1 minute.
This is a great option for some women, but not all women. I mean, you know, some women who are busy, like her, she's a pilot, busy moms, things like that. Like, I don't like to go anywhere without my makeup.
I mean, it's an ordeal putting that on every morning.
Absolutely. You know, if you're delivering babies in the middle of the night, you know, it's difficult. But also women who have allergies to makeup, women who have some medical conditions, like thyroid conditions where their eyebrows come out, or they're older and their eyebrows are thinning. Women who have, you know, problems where these kind of things are allergies, skin conditions. So this can be a great option for women. Women who are more fair-skinned, it may be a little bit more difficult to see on someone like myself, but
the key word here is permanent.
Exactly.
Once you have it, you have it for good.
Pretty much have it for a while. It does fade gradually over a period of years, but you're going to have it for quite some time. It does need periodic touch-ups to keep it looking really fresh all the time, every couple of years or so. But it is a great option. In fact, really, I can't think of very many women that in one way or another would not benefit from some form of permanent makeup.
I see a lot of patients in my practice that are very happy having had this done, but it's so important to go to somebody who does this day in and day out.
Absolutely.
And knows how to do it.
That is the key critical component to any type of, if you want to call it, extreme procedure. The person's training, the amount of time they've been doing it, they need to be an artist as well as technically trained.
Because it really is. It's like putting a tattoo on.
Absolutely. Technique is a little bit different. The equipment that I use is more specifically geared to the facial cosmetic enhancement and some paramedical tattooing. We do for scar camouflage and things like that. But technically it is implanting pigment in the dermal layer of the skin.
So it's not like where you buy makeup and you can just change it and change the colors, which I think some women like, so that's why I think it's an option, because I don't think it's for, you know,
but it sort of bridges the gap between no makeup and makeup. And you can, because it's in the skin, not on the skin like traditional cosmetics, you can actually apply other makeup colors over the top of it, and it pretty much cancels out what's underneath, and you can change the color of your lipstick or the color of your eyeliner, darken what is, you know, tattooed into the skin.
Well, I want to see what you did for Trish.
All right. Let's look at her. She looks fabulous.
There's her before shot, right?
That's Trish before.
And tell us what you did.
All right. With Trish, as you can see by looking at her, she has some sparsity and missing areas in her eyebrows, and she's quite fair and on the blonde side. So penciling her brows in every day to get them to show up. She has really no natural tone in the lid rim of her eye, and her eyelashes are fairly sparse and light, and then really her lips are virtually almost the same tonal value as her surrounding skin tone. Let's see her.
Where's Trish?
You know, the person who's doing it, because you can really change your look with your eyebrows and things like that.
I want to see the before and after side by side and see the change. There's our before and wow. So that's a lot easier in the morning now, isn't it? When you're on your trips and you wake up somewhere, all you have to do is put the uniform on and go.
That's it.
But we should mention just a few risks to it, like infection, you know, dermatological.
It's really risks like any surgical procedure.
Any tattooing
You're breaking
as well.
the skin barrier, and so there's always going to be the risk of anything from infection. And you were mentioning earlier that some skin types, the fairer the skin, usually the more impervious to bad scarring. The darker the skin tone, then you look at things like, you know, raised keloided hyperpigmentation. However, again, because of the type of equipment that we're using that's specifically designed for the facial skin, it really preserves the integrity of the skin, you know, to prevent unwanted
You're going to show us actually what you do.
Absolutely.
With your...
Let's show you exactly how it works, okay? What we have here is a sterile, disposable needle that goes into a handpiece. So this becomes like an artist tool, so I have great control over it. We're going to literally replicate the look of fine, tiny little eyebrow hairs in the skin.
And that's, again, just to remind you, it's permanent. So really the technician and the technique.
Very artistic.
You have to have the right person because it's not going to go away.
You know, I always say that if it's really good permanent makeup, you can't tell it's permanent makeup. You think they either look fantastically, naturally beautiful, or that they're very skilled with their own makeup. And literally, this needle is just making a channel for the pigment to be deposited into the skin, but with my artistic rendering and a variety of techniques determines where and how I do things on different areas of the face.
For somebody who's lost their,
you know, many women lose eyebrow hairs for a variety of reasons. Metabolic disorders, like you mentioned with the thyroid, you know, that's a huge issue in women. And then it can be from overplucking and tweezing as styles have changed throughout the years. You know, some people just aren't born with great eyebrows. You can't believe how many people have childhood scars in their eyebrows from getting stitches.
You're glad you did it, right?
Very glad.
Okay.
Yes.
All right. Thanks to Debbie and Trish.